Types of diseases. Diseases are broadly classified into two types, depending on the duration of the disease and reasons for the occurrence of disease. Further, depending on the duration, diseases can be classified into two more types: acute disease and chronic disease. Diseases that last for very short period of time are called acute diseases, whereas diseases that last for a longer time, even for lifetime, are called chronic diseases. According to reasons for the occurrence of disease, diseases are of two types: hereditary and acquired diseases. Hereditary diseases are diseases which are inherited. These are generally due to defects in the chromosomes and genes. Down syndrome is an example of hereditary disease. On the other hand, diseases which develop after birth are called acquired diseases. Acquired diseases are of two types: infectious diseases and non-infectious diseases. Infectious diseases are diseases that are caused due to infection of some microbes, like common cold, flu, and dengue. And non-infectious diseases are diseases that do not occur through infections, like diabetes and heart diseases. In this standard, we are going to do a detailed study about the two types of acquired diseases, that is, infectious and non-infectious diseases. First, let us begin with the study of infectious diseases. Infectious diseases. The germ of a disease like influenza are present in the sputum or saliva of the infected person. When this person sneezes or coughs, the germs enter the air with the droplets of saliva or sputum. Large droplets settle on the ground within few seconds, but small droplets are vaporized into fine mist and remain in the surrounding air for several minutes to few hours. When other people breathe in that same air, the germs enter their bodies and the disease spreads. The germs which cause diseases in living beings are called pathogens, and the diseases which spread from one person to another are called infectious diseases. Hepatitis, malaria, scabies, tuberculosis, dengue, dysentery, ringworm, and swine flu are some examples of infectious diseases. Hepatitis and dysentery spread through contaminated water or food. Vectors like infected mosquitoes are responsible for the spread of malaria and dengue. Scabies and ringworm are diseases of skin. They spread by skin-to-skin contact or by using clothes of the infected person. Tuberculosis and swine flu are airborne diseases which spread when the infected person coughs or sneezes and the contaminated air is inhaled by others. Thus, we can say that diseases which spread through contaminated air, water, food, or vectors like insects or other animals are termed as infectious diseases. Are you curious to know more about infectious diseases? Come, let us learn about some infectious diseases in detail. Tuberculosis. Mycobacterium tuberculosis, a bacterium, is the causative pathogen of tuberculosis. When an infected person coughs or spits, the pathogen of tuberculosis spreads through the medium of air. It can also spread when a healthy person makes prolonged contact with patient or shares materials. Some general symptoms of this infectious disease are chronic cough, blood in sputum, emaciation, and difficulty in breathing. For prevention and treatment of this disease, BCG vaccine should be given to the newly born babies. Infectious patients should be kept in isolation and regular medication like DOT should be provided to the patients. Hepatitis or jaundice. Hepatitis is caused by 5 types of viruses. Hepatitis virus A, B, C, D, and E. These viruses spread through contaminated water, sharing of needles, and by blood transfusion. The general symptoms of this disease are anorexia, that is, loss of appetite, yellow urine, nausea, vomiting, gray-colored stool, and general weakness. Simple measures like drinking boiled water and proper washing of hands help to prevent this infectious disease. Dysentery. Dysentery is a common disease of rainy season. It is caused by bacteria like Shigella, viruses and protozoans like Entamoeba histolytica. The mode of infection of this disease is contaminated food and water. After infection, the dysentery patient usually suffers from watery stool and abdominal pain. Occurrence of this disease can be easily prevented by drinking boiled water and storing food items with care. In dysentery, there is a great loss of water and electrolytes due to watery stool. Hence, ORS is given to the patients to treat severe dehydration. Cholera. Cholera is an infectious disease caused by bacterium Vibrio cholerae. This disease spreads through contaminated water and food. Some general symptoms of cholera are vomiting, severe diarrhea, and cramps in legs. To prevent cholera, one should follow good hygienic practices, avoid eating food sold in open places, and drink boiled water. One can also take vaccination against cholera for its prevention. Typhoid. Salmonella typhi, a bacterium, is the causative pathogen of typhoid. This pathogen spreads through contaminated water and food. Some general symptoms of this disease are anorexia, headache, rashes on abdomen, dysentery, and fever up to 104 degrees Fahrenheit. Drinking clean water, vaccination, proper disposal of sewage are some of the measures that should be taken to prevent this disease. Anthritis. Anthritis is caused by many pathogens such as Salmonella and E. coli bacteria. It spreads through contaminated water and food. Some common symptoms of anthritis are diarrhea and abdominal pain. This infection can be easily prevented by drinking boiled water and practicing simple hygienic habits like washing hands before eating food and after going to the toilet. Till now, we have studied about diseases which spread due to contaminated food and water and by following unhygienic practices. Based on this, let us carry out a quick Can You Tell session. Can you tell? Why should we drink boiled water in rainy season? When we boil water for drinking purpose, most of the disease-causing pathogens in water die and spread of waterborne diseases is prevented. We should always prefer to drink boiled water, especially in rainy season, because chances of contamination of water sources by pathogens are more in rainy season. How can we observe personal hygiene? To minimize risk of infection and to enhance overall health, one should follow basic personal hygiene habits like wash hands thoroughly with soap or antiseptic after going to the toilet. Brush teeth properly twice a day, once in the morning and once at night. Bath daily. Girls having long hairs should wash their hairs at least once a week. Always use a clean towel to wipe the body after bathing. Always wear clean and tidy clothes and carry a clean handkerchief. Cut your nails once a week and never bite them. Clean your ears daily with a cotton bud. Always wash hands before and after every meal. Why the Clean Hands Drive is run in schools. Swachh Bharat, Swachh Vidyalay is a national campaign launched in September 2014. In this campaign, group hand washing with soap sessions are conducted in every school before the midday meal is served. The hand washing sessions are used as an opportunity for delivering hygiene messages, especially the message that hands should be washed at two critical times: before eating and after using the toilet. Come, let us now move on to study about few more infectious diseases. Plague. The causative pathogen of plague is Bacterium Yersinia pestis. The mode of infection of this disease is through the bite of the host animals such as rat or insects such as flea. It may also spread by the consumption of contaminated water or food. Some common symptoms of this disease are fever, trouble in breathing, swollen lymph glands, and skin turning black. This disease can be prevented by keeping the rodent population under control and protecting pets from fleas. You might have definitely seen a rat in your house. Can you tell which measures are taken at your home to control the rats? Mothballs and small pieces of rat kill are placed at different places of the house. Traps are also set up to catch rats. Chickenpox. Chickenpox is a highly contagious disease caused by varicella zoster virus. It is an airborne disease which spreads through the coughs and sneezes of an infected person. It may also spread through contact with the blisters. A very common symptom of this disease is characteristic skin rash that forms small itchy blisters. Rash usually starts on the chest, back, and face, then spreads to the rest of the body. Other symptoms of chickenpox include fever, tiredness, and headaches. The spread of this infection can be prevented by vaccination and isolating the affected individuals. Take a close look at this picture. Where do you see the waterlogged materials shown in picture? We see these waterlogged materials at waste dumping ground, kitchen, backyard of our house, cattle sheds, compound walls, and in our drawing room. Which hazards do you anticipate with the help of picture? We know that mosquitoes lay their eggs in waterlogged places and thereby their population increases. Different species of mosquitoes spread different diseases. Therefore, diseases like malaria and dengue can be anticipated. Come, let us learn about these diseases in detail. Malaria. The causative pathogen of malaria is Plasmodium vivax. It spreads when an infected female Anopheles mosquito bites a healthy person. Some common symptoms of malaria are headache, extreme muscular pain, and fever. Some measures that can be taken to prevent malaria are keeping surroundings clean, preventing stagnation of water, and taking measures to control breeding of mosquitoes. Dengue. The causative pathogen of dengue is Den 1, 2, 3, and 4 viruses which belong to genus Flavivirus. It is spread by the bite of Aedes aegypti mosquito. These mosquitoes lay their eggs in waterlogged places and thereby their population increases. Pain in the eye socket is the most prominent symptom of this disease. Acute fever, headache, and vomiting is also witnessed in case of dengue. The platelet count of dengue patient also decreases rapidly, that may lead to internal hemorrhage. Look at these pictures. Can you sort them as reasons and preventive measures of dengue? Yes. Image 2, 4, and 7 are images of articles which we use in our household for the storage of water and for cooling. Stagnant water present in and around them may give suitable environment to Aedes mosquitoes to breed. Therefore, these images are the reasons for the occurrence of disease. On the other hand, images 1, 3, 5, and 6 are the measures taken to prevent dengue. Use of mosquito repellent coils and liquid in homes for mosquito control are so common nowadays. For mosquito control, Gram Panchayat, municipal council or municipality use fogging machine in the residential areas. Fishes like Gambusia and Guppy are larvivorous. They are introduced in the water bodies to prevent breeding of mosquitoes. One of the simplest and easy measure to prevent dengue is wearing full clothes, due to which the bite by an infected Aedes mosquito can be easily prevented. Do you know? Malaria is caused by the bite of infected female Anopheles mosquito, while dengue is caused by the bite of infected Aedes mosquito. Both types of mosquitoes grow in clean water, but infected female Culex mosquito, which spreads elephantiasis, grows in dirty sewage water. After the study of infectious disease spread by mosquitoes, let us now study about infectious diseases which are spread by animals like pig, dog, cat, monkey, etc. Swine flu. Swine flu is caused by the virus influenza A, H1N1. First case of swine flu was reported in Mexico in 2009. Infection of swine flu occurs through infected pigs and humans. Persons who come in contact with these pigs and humans can contract this disease. Viruses of swine flu are spread through sweat of infected person. Similarly, it can also be spread through secretions of nose, throat, and saliva. Some common symptoms of swine flu are difficulty in breathing, sore throat, and body pains. For diagnosis of this disease, liquid from the throat of patient is taken and sent in laboratory. Diagnostic facilities for swine flu are available in the National Institute of Virology, that is NIV, Pune, and National Institute of Communicable Diseases, that is NICD, Delhi. Rabies. Rabies is contracted by the bite of an infected dog, rabbit, monkey, cat, etc. It is a viral disease. When infected animal bites, virus present in saliva enters the human body and reaches to the brain via neurons. Symptoms of rabies usually start to appear within 90 to 175 days of dog bite. Some common symptoms of this disease are fever for 2 to 12 weeks and exaggerations in behavior. Hydrophobia is one of the important symptoms of this disease. Patient shows extreme fear for water. Rabies is a fatal disease. However, fatality can be prevented by timely vaccination before the onset of symptoms. After this quick discussion about infections through animals, can you tell why is it necessary to care about health of domestic dogs, cats and birds? It is necessary to care about health of domestic animals and birds because if they are not vaccinated regularly, they may contract infectious diseases and risk of spread of infectious diseases among the family members increases. Why the animal cages and their living places should not be near the kitchen? Animal cages and their living places should not be near the kitchen because their excreta may contaminate our food and water, due to which we may fall ill. Is there any relation between pigeons, stray animals, and human health? Yes, both of them, pigeons and stray animals, can be responsible for health hazards in humans. What are the effects of rats, cockroaches on human health? Rodents like rats and insects like cockroaches can also affect human health. Rats can cause diseases like leptospirosis and salmonellosis in humans. The causative pathogen of these diseases spread through direct contact of humans with urine of infected rats or through water, soil or food contaminated with their urine. Rats also spread plague in humans. On the other hand, cockroaches passively transport pathogens present on their body to the food. Consumption of such contaminated food causes infections of bacteria like E. coli and Salmonella species in humans. Do you know? We can prevent ourselves from most of the infectious diseases by getting vaccinated. Vaccination gives protection from the infectious diseases. This is the vaccination schedule chart. For best protection against diseases, it is necessary that we should get all these vaccines on time. To eliminate polio, Government of India started Pulse Polio Immunization Program in 1995 by vaccinating all children under the age of 5 years against the polio virus. Till now, we have studied about infectious diseases which spread through contaminated food and water, by vectors and by animals. But do you know that there are also infectious diseases which spread through sexual contact? AIDS is one of them. Come, let us study about AIDS in brief. AIDS. AIDS stand for Acquired Immunodeficiency Syndrome. This syndrome is caused by HIV, that is, Human Immunodeficiency Virus. This virus spreads through blood, unsafe sexual contact, and milk of mother suffering from AIDS. Symptoms of AIDS are person-specific. Person having AIDS suffer from various diseases due to progressive weakening of natural immunity. ELISA test is used for the proper diagnosis of AIDS. Do you know? HIV was first reported in an African species of monkey. According to National AIDS Control Program and UNAIDS, 80 to 85% HIV infections in India occur through unsafe sexual contacts. Always remember, AIDS does not occur due to touching and sharing food with HIV-infected person or by nursing the HIV patient. Our behavior with HIV-infected person must be normal. So far, we have studied about various infectious diseases in detail. See this table. Can you recall and fill the necessary information about these diseases? After learning about infectious diseases in detail, let us now proceed to learn about another type of acquired diseases, that is, non-infectious diseases. Non-infectious diseases. Diseases which do not occur through infections and body contacts are called non-infectious diseases. Such diseases arise in human body itself due to certain reasons. Let us learn about some of these diseases in detail. Cancer. Uncontrolled and abnormal cell growth is called cancer. Group or lump of cancerous cells is called malignant tumor. Cancer can occur in various organs of the body like lungs, mouth, tongue, stomach, breast, uterus, skin, and also in tissues like blood. There are many possible reasons which may induce cancer in human body. Some of them are consumption of tobacco, gutka, alcohol, smoking, lack of fiber content like fruits and leafy vegetables in diet, excessive consumption of junk food like pizza, burger, etc. Heredity may also be a reason. Symptoms of cancer depend upon the body part in which cancer develops. Chronic cough, hoarse voice, difficulty in swallowing, incurable scar and inflammation, lumps in breast, and unexplained weight loss are symptoms of some types of cancer. Nowadays, modern diagnostic and treatment facilities for cancer are available. Techniques like CT scan, MRI scan, mammography, biopsy are used in the diagnosis of cancer. For treatment, along with conventional methods like chemotherapy, radiation therapy, and surgery, modern techniques like robotic and laparoscopic surgery are also followed. Always remember, controlled diet helps to prevent some types of cancers. Physical exercise along with modern treatment is more beneficial to cure the cancer. Say no to addictions like tobacco chewing, smoking, etc. to prevent cancer. Raju Chacha always drinks sugar-free tea and avoids eating sweets. I always always wonder what could be the reason for this. Oh, come, let us do a detailed study of diabetes. Diabetes. The hormone insulin produced in pancreas controls the level of sugar glucose in blood. If insulin is secreted in low quantity, glucose level cannot be controlled. This disorder is called diabetes. If a person suffers from symptoms like increased thirst, frequent urination at night, obesity, or unexplained weight loss, it should not be ignored. The person should consult a doctor immediately because there is always a possibility that the person may be suffering from diabetes. There can be various reasons for a person to be diabetic. Some of them are heredity, obesity, lack of physical exercise, and mental stress. Diabetes is a chronic, lifelong disease. Therefore, to keep it under control, patients should always follow a proper diet, should take the prescribed medicines regularly, and exercise under the supervision of a doctor. Do you know? India has the largest number of diabetes patients in the world. At present, approximately 7 crore diabetes patients are present in the country. Come, let us now move on to study about another very common non-infectious disease, that is heart disease. Heart diseases. Efficiency of the heart decreases due to decreased blood supply and thereby oxygen and nutrient supply to the heart muscles. Due to this, heart has to perform more work that leads to stress on it. This may cause heart attack. If a person experiences symptoms like severe chest pain, pains in shoulder, neck and arms, cramps in hand, uneasiness or tremors, it should not be ignored. The person should immediately consult a doctor because it could be a heart attack for which immediate treatment is must. Several factors like smoking, alcoholism, diabetes, hypertension, obesity, lack of physical exercise, mental stress, anger, anxiety, and heredity can be responsible for a heart attack. The treatment of heart disease depends upon the severity of the disease. Apart from medicines, surgical options like angioplasty, installation of stents, bypass surgery, open heart surgery, installation of pacemaker, and heart transplantation are considered for the treatment of heart diseases. Always remember, at the time of heart attack, first call 108 for ambulance. Check the consciousness of patient by shaking the shoulders. Keep the patient lying on the back in horizontal position on hard surface and perform compression-only life support, that is COLS. To perform this, press the center of thorax for at least 30 times at the rate of 100 or 120 strokes per minute. After studying about various diseases, let us now proceed to the next part of the chapter, that is methods of treatment.